Question 1. A nurse enters a patient's room and notices the bed alarm is turned off despite the patient being a high fall risk. What should the nurse do first to ensure patient safety? A. Educate the patient about calling for assistance before standing. B. Reactivate the bed alarm. C. Report the issue to the charge nurse. D. Document that the alarm was off. Answer: B. Reactivate the bed alarm. Rationale: reactivating the alarm immediately restores essential safety protection for a high-risk patient. Education is important, but not the immediate priority when a risk is present. A. Reporting should occur after immediate safety action. C. Documentation is necessary, but not before safety is restored. D. Question 2. A nurse prepares to administer insulin to the wrong patient, but catches the error during the 2 identifier check. What is the most appropriate action to support patient safety? A. Discard the insulin and continue with the shift. B. Complete an incident report. C. Notify the provider immediately. D. Apologize to the patient and move on. Answer: B. Complete an incident report. Rationale: incident reports are required to document near misses to improve safety processes. B. Discarding insulin without reporting prevents system improvement. A. The provider does not need notification for a near miss with no harm. C. Simply apologizing misses the legal and safety requirement for reporting. D. Question 3. A nurse notices a new medication order that has an unusually high dosage. What should the nurse do to ensure patient safety? A. Administer the medication as written. B. Ask another nurse if the dose looks correct. C. Hold the medication and contact the provider for clarification. D. Wait to see if pharmacy sends a corrected order. Answer: C. Hold the medication and contact the provider for clarification. Rationale: any dosage outside expected range must be clarified with the prescriber before administration. C. Administering it risks harm. A. Asking another nurse is not sufficient verification. B. Waiting for pharmacy risk delay and potential error. D. Question 4. A patient with a history of falls insists on walking independently to the bathroom. Which action ensures the highest level of patient safety? A. Allow the patient to walk independently if they feel confident. B. Provide a walker, but remain outside the bathroom. C. Offer to stay and assist the patient to the bathroom. D. Encourage the patient to hold onto furniture for support. Answer: C. Offer to stay and assist the patient to the bathroom. Rationale: high fall risk patients require direct assistance. C. Allowing independent ambulation, A, or partial supervision, B, is unsafe. Holding furniture is hazardous. D. Question 5. A nurse receives a verbal order during a noisy emergency situation. What is the safest action? A. Write down the order and carry it out. B. Ask another nurse to confirm the order. C. Read back the order to the provider for verification. D. Wait until the situation is calmer to clarify. Answer: C. Read back the order to the provider for verification. Rationale: the read-back process prevents communication errors. C. Writing and executing without verification is unsafe. A. Asking another nurse is not acceptable verification. B. Waiting may delay urgent care. D. Question 6. A nurse discovers that a medication with a known allergy is scheduled for administration. What is the nurse's priority action? A. Remove the medication from the room and notify the provider. B. Administer the medication because the provider ordered it. C. Ask the pharmacist if the allergy is severe. D. Document that the medication was not given and leave it at that. Answer: A. Remove the medication from the room and notify the provider. Rationale: preventing exposure to a known allergen is the priority. A. Providers can make ordering errors, so administration is unsafe. B. Pharmacy does not determine allergy severity. C. Documentation alone does not ensure safety. D. Question 7. A nurse finds unlabeled tubing attached to a patient's IV pump. What is the safest nursing action? A. Continue using the tubing if the fluid seems appropriate. B. Replace the tubing and label it according to facility policy. C. Ask the patient what the IV solution is. D. Leave the tubing until the next scheduled change. Answer. B. Replace the tubing and label it according to facility policy. Rationale. Unlabeled tubing is unsafe. Replacement and correct labeling prevent medication errors. B. Continuing to use it risks harm. A. Patients cannot reliably identify IV solutions. C. Leaving it in place violates safety protocols. D. Question 8. During bedside report, a nurse notices the patient's oxygen is disconnected. What should the nurse do first? A. Complete the report, then fix the oxygen. B. Reconnect the oxygen immediately. C. Tell the off-going nurse to reconnect it. D. Document the incident before taking action. Answer. B. Reconnect the oxygen immediately. Rationale. Restoring oxygenation takes priority over documentation or discussion. B. Completing report delays necessary intervention. A. Delegating to the off-going nurse delays care. C. Documentation must follow intervention. D. Question 9. A nurse suspects that a colleague is diverting narcotics after noticing repeated discrepancies. What is the nurse's ethical responsibility? A. Confront the colleague privately. B. Ignore it unless patient harm occurs. C. Report the suspicion to the nurse manager immediately. D. Tell other coworkers to watch the colleague. Answer. C. Report the suspicion to the nurse manager immediately. Rationale. Reporting through proper channels protects patient safety and meets legal or ethical obligations. C. Confronting the colleague is unsafe and inappropriate. A. Ignoring the situation endangers patients. B. Gossiping violates professional conduct. D. Question 10. While preparing to administer medications, a nurse is interrupted 3 times by staff members. What action best promotes medication safety? A. Continue preparing medications while talking. B. Ask staff to limit interruptions using a designated safety protocol. C. Move to a more crowded area for better visibility. D. Prepare medications faster to reduce error risk. Answer. B. Ask staff to limit interruptions using a designated safety protocol. Rationale. Limiting interruptions reduces medication errors. B. Continuing with distractions increases risk. A. Crowded areas worsen interruptions. C. Speeding up increases risk of mistakes. D. Question 11. A nurse notes that a postoperative patient on PCA morphine is difficult to arouse and has shallow respirations at 8 per minute. What should the nurse do first to ensure patient safety? A. Stop the PCA infusion and stimulate the patient. B. Notify the rapid response team. C. Apply a non-rebreather mask. D. Document the findings. Answer. A. Stop the PCA infusion and stimulate the patient. Rationale. The immediate cause is opioid oversedation. Stopping the PCA and stimulating helps improve respirations. A. Calling RRTB may follow but does not address the immediate safety need. Oxygen. C. Does not reverse depression. Documentation. D. Is done after the emergency is managed. Question 12. A nurse receives a new order for IV potassium at a rate of 50 milliequivalent per hour. What is the safest action? A. Administer as ordered because it is a provider prescription. B. Verify the order with the provider immediately. C. Ask pharmacy to adjust the infusion rate. D. Dilute the potassium further and administer. Answer. B. Verify the order with the provider immediately. Rationale. 50 milliequivalent per hour is dangerously high and can cause fatal arrhythmias. Verification is mandatory. B. Following the order, A, is unsafe. Pharmacy cannot change orders independently. C. Independently diluting medication violates scope. D. Question 13. During a blood transfusion, the patient develops chills and flank pain. What should the nurse do first? A. Increase the infusion rate. B. Stop the transfusion immediately. C. Notify the provider before taking any action. D. Flush the IV with the same blood tubing. Answer. B. Stop the transfusion immediately. Rationale. Signs of reaction require stopping the transfusion immediately. B. Increasing rate. A. Worsens the reaction. Calling provider is necessary, but must follow stopping the infusion. C. Using the same tubing. D. Is unsafe. Question 14. A nurse notes that the crash cart defibrillator is unplugged during morning rounds. What is the most appropriate priority action? A. Plug in the defibrillator and document the finding. B. Report the issue after finishing medication rounds. C. Check all other emergency equipment for readiness. D. Inform the biomedical department immediately. Answer. A. Plug in the defibrillator and document the finding. Rationale. The first priority is restoring immediate emergency readiness. A. The nurse must act before reporting. B. Checking other equipment. C. Is important but comes after emergency readiness is restored. Biomedical. D. Can be notified after immediate correction. Question 15. A patient with a new tracheostomy has oxygen saturation dropping from 96% to 84%. What should the nurse do first? A. Call respiratory therapy. B. Prepare for possible intubation. C. Assess for airway obstruction and suction the tracheostomy. D. Increase the oxygen flow rate. Answer. C. Assess for airway obstruction and suction the tracheostomy. Rationale. Sudden desaturation post-trach is most often obstruction. Clearing airway is priority. C. Calling RT delays care. A. Intubation prep. B. Is later. Oxygen flow increase. D. Does not relieve obstruction. Question 16. A nurse administers a wrong medication dose, but the patient is stable with no adverse effects. What is the safest and legally correct action? A. Tell the patient only if symptoms develop. B. Report the error, assess the patient, and complete incident documentation. C. Ask a coworker to help decide whether to report it. D. Avoid documenting the error to prevent legal problems. Answer. B. Report the error, assess the patient, and complete incident documentation. Rationale. Reporting and assessing are required for patient safety and legal protection. B. Hiding the error, AD, violates legal or ethical duties. Coworker consultation, C, is inappropriate. Question 17. A nurse notes that two high-alert medications look almost identical and are stored next to each other. What is the priority action? A. Move one medication to a separate, clearly labeled storage area. B. Inform pharmacy during their next routine visit. C. Tell coworkers to be careful. D. Do nothing unless an error occurs. Answer. A. Move one medication to a separate, clearly labeled storage area. Rationale. Immediate correction of an unsafe environment prevents serious errors. A. Waiting for pharmacy. B. Or error occurrence. D. Delays correction. Telling coworkers. C. Is insufficient. Question 18. A patient on contact precautions is about to be transported for a CT scan. What should the nurse do to ensure safety and compliance? A. Transport the patient without precautions because CT is non-invasive. B. Notify CT staff and ensure proper PPE and transport precautions. C. Keep the patient in the room and cancel the CT. D. Transport the patient with no additional steps. Answer. B. Notify CT staff and ensure proper PPE and transport precautions. Rationale. Interdepartmental communication reduces spread of infection. B. Transport must still follow precautions. D. Canceling the CTC is not appropriate without medical reasoning. Question 19. A nurse must delegate tasks on a busy shift. Which delegation ensures the greatest patient safety? A. Assigning a new, unlicensed assistant to a fresh postoperative patient. B. Delegating vital signs on a stable patient to a trained UAP. C. Delegating IV medication administration to a UAP. D. Assigning patient assessment to an LPN for a newly unstable patient. Answer. B. Delegating vital signs on a stable patient to a trained UAP. Rationale. Vital signs for stable patients are appropriate for UAPB. Post-op patients require RN supervision. A. UAP cannot give IV meds. C. Unstable patients require RN assessment. D. Question 20. A nurse finds a spilled liquid on the floor near the patient bathroom. What should the nurse do first? A. Call housekeeping to clean it later. B. Place a wet floor sign and clean the spill immediately. C. Document the hazard in the chart. D. Warn the patient verbally but leave it. Answer. B. Place a wet floor sign and clean the spill immediately. Rationale. Immediate removal of hazard prevents falls. B. Calling housekeeping. A. Delays safety. Documentation. C. Is secondary. Warning. D. Is insufficient. Question 21. A nurse receives 2 urgent pages at once. One patient's oxygen saturation dropped to 80%, and another patient requests pain medication for 8 out of 10 pain. What is the priority action? A. Give the pain medication first. B. Go immediately to the patient with oxygen saturation of 80%. C. Delegate oxygen assessment to a UAP. D. Ask the pain patient to wait until the oxygen issue is resolved. Answer. B. Go immediately to the patient with oxygen saturation of 80%. Rationale. Threats to airway or oxygenation always take priority. B. Pain is important but not life-threatening. AD. UAP cannot assess oxygenation. C. Question 22. During handoff, the incoming nurse sees an IV pump alarming occlusion. What should the nurse do first? A. Silence the alarm and address it later. B. Check for kinks or obstructions in the tubing. C. Replace the IV pump. D. Document that the pump is alarming. Answer. B. Check for kinks or obstructions in the tubing. Rationale. Most occlusions come from simple tubing issues. B. Silencing delays safety. A. Pump replacement. C. Is secondary. Documentation. D. Is not the first priority. Question 23. A patient receiving heparin shows a sudden drop in platelet count. What should the nurse do first to ensure patient safety? A. Continue the heparin infusion. B. Notify the provider and stop the heparin. C. Document the platelet level. D. Ask the lab to repeat the test. Answer. B. Notify the provider and stop the heparin. Rationale. Sudden platelet drop suggests it, requiring immediate discontinuation. B. Continuing infusion. A. Is dangerous. Lab repeat. D. Delays intervention. Documentation. C. Follows. Question 24. A patient repeatedly removes their NG tube despite redirection. What is the safest intervention? A. Apply soft mitt restraints with a provider order. B. Use 4-point restraints. C. Assign a sitter without notifying the provider. D. Tape the patient's hands to the bed. Answer. A. Apply soft mitt restraints with a provider order. Rationale. Soft restraints with an order protect airway and nutrition needs safely. A. 4-point restraints. B. Are unnecessarily restrictive. Sitter use. C. Requires provider communication. Taping hands. D. Is illegal and unsafe. Question 25. A nurse hears an alarm indicating a patient's IV is infiltrated. What should the nurse do first? A. Increase the flow rate. B. Stop the infusion and assess the site. C. Apply heat immediately. D. Ignore the alarm unless swelling appears. Answer. B. Stop the infusion and assess the site. Rationale. Stopping the infusion prevents further injury. B. Increasing rate. A. Worsens infiltration. Heat. C. Depends on solution type. Ignoring the alarm. D. Is unsafe. Question 26. A patient is confused and trying to pull at their chest tube. What is the nurse's priority intervention? A. Re-explain why the tube is needed. B. Call the provider for a sedation order. C. Stay with the patient and ensure tube security. D. Apply restraints immediately. Answer. C. Stay with the patient and ensure tube security. Rationale. Chest tubes are life-preserving. Immediate presence prevents accidental removal. C. Education alone may not work. A. Sedation. B. Comes after immediate safety. Restraints. D. Require assessment and order. Question 27. A medication label is smudged and unreadable. What should the nurse do to ensure safety? A. Administer if the medication looks familiar. B. Request a replacement from pharmacy. C. Ask another nurse to guess the medication. D. Use the medication and label it afterward. Answer. B. Request a replacement from pharmacy. Rationale. Unreadable labels risk serious errors. B. Guessing or relying on appearance. AC is unsafe. Relabeling afterward. D. Violates policy. Question 28. A nurse finds a syringe on the bedside table in a semi-conscious patient's room. What is the priority action? A. Dispose of the syringe in a sharps container. B. Ask the patient how the syringe got there. C. Document and leave the syringe in place. D. Call security immediately. Answer. A. Dispose of the syringe in a sharps container. Rationale. The syringe poses an immediate harm risk. A. Asking the patient. B. Delays action. Leaving it. C. Is unsafe. Security. D. May be needed later, depending on findings. Question 29. A nurse observes a provider entering the room without performing hand hygiene. What should the nurse do? A. Ignore it because the provider is experienced. B. Politely remind the provider to perform hand hygiene. C. Report the provider immediately without speaking to them. D. Perform hand hygiene for the provider. Answer. B. Politely remind the provider to perform hand hygiene. Rationale. Encouraging safe practice supports patient safety and interprofessional communication. B. Ignoring. A. Enables risk. Reporting without communication. C. Is premature. Performing hygiene for someone. D. Is inappropriate. Question 30. A nurse discovers a fire in a patient's room. Which action follows the RACE protocol? A. Extinguish the fire immediately. B. Rescue the patient from the room first. C. Pull the fire alarm, then evacuate. D. Close the doors and continue routine care. Answer. B. Rescue the patient from the room first. Rationale. RACE. Rescue, alarm, contain, extinguish. The first step is patient rescue. B. Extinguishing. A. Is last if safe. Alarm. C. Comes after rescue. Continuing routine care. D. Is unsafe. Question 31. A nurse notices that the insulin pens for several patients are stored together in a shared bin, despite policy requiring individual labeled storage. What is the safest and most immediate action? A. Quickly administer insulin to avoid delays. B. Separate and label each pen with the correct patient's name. C. File an incident report without taking further action. D. Inform night shift to fix the storage issue. Answer. B. Separate and label each pen with the correct patient's name. Rationale. Mixed insulin pens pose a severe risk of cross-contamination and medication errors. Immediate correction. B. Prevents harm. Administering insulin. A. Does not address the safety violation. Reporting alone. C. Without fixing, the hazard leaves ongoing risk. Delaying correction. D. Is unsafe. Question 32. A patient on a PCA pump reports no pain relief, but the pump shows multiple unsuccessful attempts. What is the priority safety action? A. Tell the patient to keep pressing the button. B. Assess the IV site and verify PCA connection for dislodgement. C. Increase the PCA dose. D. Document the patient's complaint for later review. Answer. B. Assess the IV site and verify PCA connection for dislodgement. Rationale. Ineffective PCA delivery usually indicates an IV or connection problem. Assessment prevents undermedication and withdrawal. B. Encouraging more attempts. A. Is ineffective. Increasing dose. C. Is unsafe without checking the cause. Documentation. D. Is secondary. Question 33. A nurse is caring for 4 patients. Which situation requires immediate action to prevent patient harm? A. A patient requesting toileting assistance. B. A post-op patient with a new onset of restlessness and rising respiratory rate. C. A stable patient waiting for discharge instructions. D. A patient reporting mild nausea after a meal. Answer. B. A post-op patient with a new onset of restlessness and rising respiratory rate. Rationale: restlessness plus increased RR indicates early hypoxia or internal bleeding. Immediate intervention prevents deterioration. B. Toileting A, teaching C, and nausea D are non-emergent. Question 34. A nurse is flushing a central line when the patient suddenly coughs and becomes short of breath. What should the nurse do first to ensure safety? A. Stop flushing and place the patient on left side with head down. B. Call the provider immediately. C. Continue flushing in case the line is blocked. D. Document the reaction. Answer: A. Stop flushing and place the patient on left side with head down. Rationale: symptoms indicate possible air embolism. Left side Trendelenburg traps air and protects circulation. A. Calling provider. B. Comes after emergency positioning. Continuing flush. C. Worsens the problem. Documentation. D. Is last. Question 35. A patient with dementia is found wandering near the exit door of a locked dementia unit. What action ensures the highest level of safety? A. Return the patient to the room and close the door. B. Activate the unit's safety alarm and redirect the patient. C. Apply restraints to prevent wandering. D. Ask another staff member to keep an eye on the patient. Answer: B. Activate the unit's safety alarm and redirect the patient. Rationale: units with wander risk protocols require alarm activation plus redirection. B. Closing doors. A. Does not prevent further wandering. Restraint. C. Violates safety/ethics unless last resort. Watching the patient. D. Is insufficient. Question 36. A nurse identifies a near miss. A medication was almost administered to the wrong patient, but the error was caught at the last second. What is the nurse's immediate requirement? A. Ignore it since the error did not reach the patient. B. Report the near miss according to facility safety policy. C. Only tell the charge nurse verbally. D. Wait to see if similar incidents occur. Answer: B. Report the near miss according to facility safety policy. Rationale: near misses must be reported to improve system safety. B. Ignoring A. Loses improvement opportunity. Verbal reports only. C. Are incomplete. Waiting. D. Is unsafe. Question 37. A new nurse questions a medication order because the dose seems unusually high for the patient's age and renal status. What is the most appropriate safety action? A. Administer the dose exactly as written. B. Hold the medication and clarify the order with the provider. C. Ask another nurse whether they would give it. D. Split the dose in half and give it. Answer: B. Hold the medication and clarify the order with the provider. Rationale: high-risk discrepancy requires clarification to prevent harm. B. Administering A. Is unsafe. Asking peers. C. Does not replace provider verification. Altering dose without order. D. Violates legal practice. Question 38. A patient receiving a transfusion begins experiencing anxiety and a sensation of something is wrong, but no visible symptoms appear yet. What should the nurse do first? A. Reassure the patient that this is normal. B. Slow the transfusion and assess vital signs immediately. C. Continue the transfusion until symptoms worsen. D. Stop the transfusion completely without assessment. Answer: B. Slow the transfusion and assess vital signs immediately. Rationale: early transfusion reactions often start subtly. Slowing infusion plus assessment. B. Ensures early detection and prevents escalation. Reassurance. A. Ignores warning signs. Stopping transfusion immediately. D. Is appropriate only when clear reaction symptoms appear. Continuing without assessment. C. Is unsafe. Question 39. A nurse finds that a patient's bed alarm was intentionally turned off by another staff member to reduce noise. What is the safest immediate action? A. Turn the alarm back on and notify the charge nurse. B. Document the situation but take no other action. C. Leave the alarm off because the patient is currently asleep. D. Ask the co-worker to turn it back on later. Answer: A. Turn the alarm back on and notify the charge nurse. Rationale: bed alarms are essential fall prevention tools. Restoring safety plus reporting. A. Prevents harm and ensures accountability. Documentation alone. B. Does not protect the patient. Leaving the alarm off. C. Puts the patient at risk. Telling the coworker later. D. Delays correction. Question 40. A diabetic patient refuses their evening blood glucose check, stating, "I already know it is normal." What is the priority, safety-focused nursing action? A. Document refusal and walk away. B. Educate the patient on risks of hyper and hypoglycemia and reassess willingness. C. Force the glucose check because the order requires it. D. Call security to assist with the check. Answer. B. Educate the patient on risks of hyper and hypoglycemia and reassess willingness. Rationale. Patient refusal must be met with education and shared decision-making. B. Walking away. A. Ignores safety risk. Forcing care. C.D. Violates patient rights and safety ethics. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.